I'm going to talk about the upper and lower limb veins and arteries. We'll start with the upper limb anatomy. These are the main arterial vessels that you need to know. Let's start proximally. The subclavian artery becomes the axillary artery at the lateral edge of the first rib. The axillary artery gives off a circumflex branch, which isn't actually pictured here, that comes around the humeral head. The axillary artery then becomes the brachial artery at the lower border of the teres major muscle. The brachial artery has a deep brachial artery branch or profunda brachial artery. The brachial artery then divides into the radial and ulnar arteries at the elbow. The ulnar artery gives off a common interosseous artery, which divides into the anterior and posterior interosseous arteries. At the wrist, they become the superficial and deep palmar arches, which then give off the digital arteries, and that's all you need to know in the hand. Again, in the hand, ulnar and radial artery give off the deep and superficial arches deep and superficial palmar arches, which then give off the digital arteries, which go along the both sides of the fingers. The veins have a deep and superficial component. The deep component mirrors the arterial anatomy, so I won't go through that. The superficial component, you've got the cephalic vein, which is on the outside of the arm, which is the vein that pops out in people with big muscles. That connects to the deep venous system at the level of the subclavian vein. So actually it comes under the clavicle and then joins back around here. The basilic artery is on the inside of the arm, which joins with the axillary vein, which is actually a little bit more proximal here at the level of the armpit. You've got the median cubital vein as well, which would be where people often get blood. Take blood. Let's go through some questions. The first thing you need to ask yourself when you get these images is, where are you? We're at the level of the elbow. This is the radius. This is the ulnar. This is the humerus. And then what is this? Is this an artery or a vein? The arteries are a lot more crisp. The edge is a lot more crisp. The veins are a lot more wavy. So this is an artery. So this would be the brachial artery dividing into the ulnar and radial arteries. You know this is the ulnar not just because of where it is, but because the ulnar gives off the interosseous branches, the anterior and posterior interosseous branches, and the common here. This case is at the level of the humeral head. So A is the axillary artery. Off the axillary artery, like I mentioned, you get a circumflex humeral artery, which wraps around the humeral head. This axillary artery becomes the brachial artery inferior to the teres major muscle, which is this. So this is the brachial artery. D is the profunda brachial artery or brachii, which was the main branch that I mentioned before. E is apparently the superior ulnar collateral artery. You don't need to know that for the exam. Again, you need to ask yourself, what is this? They've got a catheter here, and this doesn't follow any arterial anatomy, and this is at the humerus. And so these are veins. So they've injected here a vein. So you're asking yourself, is this cephalic or is this basilic? You can see the radial head here. So this is on the outside of the arm. So this would be the cephalic vein here. So they've injected that. A would be the medial cubital vein, so where you take the blood. E would be your cephalic vein. B would be your deep brachial veins, so these would be the venous equivalents of the profunda brachial arteries. I think if they showed this, it would be actually quite harsh. It's quite difficult. C is your brachial vein, and then D, they're pointing to a valve. Again, I don't think they're going to ask that. This is at the level of the clavicle, so this is your subclavian artery, the structure here. But A would be your right subclavian artery. B would be your right common carotid artery going into the neck. These are the branches of the subclavian artery, which I mentioned in the upper limb lecture. sorry, I mentioned it in the thoracic lecture, so we can go back to that. C is the right axillary artery, and you know it's the axillary artery because the first rib is around here somewhere. This would be the second rib, so you're way lateral of that, and so you're at the axillary artery, and then it's coming down here. We know this is the humerus, and then we need to ask ourselves, is this arterial veins? These look like veins, right? They're a bit squiggly, and then you've got this, the median antecubital vein, where you take blood. You then need to ask, is this radial or ulnar? So you look at the elbow. This doesn't look like the radial head. This looks like the trochlea and the proximal ulnar, and so this would be the inner margin of the arm. So B would be your basilic vein, A would be your cephalic vein. So you need to orientate yourself. We know that this is the brachial vein because we're at the elbow, but then when someone's elbow is bent, it sort of is coming in slightly, and so this side would be the radial side, this side would be the ulnar side, and so where it branches, this would be the radial artery, this would be the ulnar artery. And the other reason we know that this is ulnar is because off the ulnar you get the anterior and posterior interosseous branches. We know that this is a vein just because of that sort of squiggly pattern. It's less crisp than the arteries, which looks so much more crisp and less dilated. So it's asking what level is this? We can see the first rib here, so it can't be subclavian. The teres major would be around here, so this would be the left axillary vein. Again, these look like veins, squiggly, valves, so you just need to take it from where you are. Starting proximally is actually a bit helpful. So this would be the left brachiocephalic vein. B would be the internal jugular vein coming from the neck. C would be the subclavian vein because it's medial to the first rib, which is here. D would be the axillary vein because it's lateral to it. And then E would be your, it would either be your basilic or your brachial vein. I think it's actually quite hard to tell. This is your basilic vein. I think brachial is this one, basilic is this one. I think it's hard to tell without showing the rest of the arm. We know we're at the forearm, radius ulnar, so this would be the radial artery, this would be the ulnar artery. C would be your interosseous arteries. Again, it's hard to tell if it's anterior or posterior, and so if you're not sure, just say interosseous artery, and then that's your lunate, which we've discussed before. It's asking what artery divides into two major branches, A and B, at the level of the elbow, which is your brachial artery. So let's go over the lower limbs now. There's a lot going on in this image. The things that you need to know is that the common iliac artery divides into the internal and external iliac artery. The external iliac artery is what we're going to concentrate on. That creates the common femoral artery at the level of the inguinal ligament, which goes from the pubic symphysis to the acis. The common femoral artery divides into the superficial femoral artery and then the profunda femoral artery. Actually, a little bit more proximal to it, coming from the external iliac artery, is the circumflex artery, which goes around the femoral head, and it's important when it comes to intra and extracapsular neck of femur fractures. The superficial femoral artery comes down and at the knee creates the popliteal artery. And then this is where it becomes a little bit trickier. We'll go through some cases, but there is a common perineal trunk. The common perineal trunk gives off the posterior tibial and the perineal artery, which you can see here. So the posterior tibial artery and the perineal artery. More proximal to it, you have your anterior tibial artery, which then creates your dorsalis pedis at the foot. And then remember, the posterior tibial artery, when you're examining patients, is behind the ankle where you're feeling that pulse. So common perineal trunk, gives off the posterior tibial and peroneal artery. It's something that you need to remember because it can otherwise catch you out. The veins are quite straightforward. You have the veins mirroring the deep arteries, and then the superficial system. You've got your great saphenous vein along the medial leg, and then you've got the short saphenous vein draining into the popliteal vein. The great saphenous vein drains into the femoral vein at the saphenofemoral junction, which we often see when we're doing these DVT studies. It's called the femoral vein and not the superficial femoral vein is the other thing, and then the deep femoral vein is here. This is the arteries again, just to sort of highlight that they can try and trick you out below the knee. So you've got your popliteal artery, your tibioperoneal trunk, which creates your peroneal and posterior tibial arteries, and then your anterior tibial artery comes off the popliteal artery, which then gives off your dorsalis pedis. Important to try and remember this because I think they can try and trick you out and it's quite difficult. So let's go through some questions. So we need to ask ourselves where we are. This is at the knee. You can see this is the tibia. So this would be the popliteal artery. So 1 would be your popliteal artery. It's given you your side, so you know it's the right. Remember to write that in the exam, what side it is if you know. Then the first thing that comes off is your anterior tibial artery, which remember gives off the dorsalis pedis. And then you've got the tibioperoneal trunk, which gives off the peroneal artery. And then number 4 is the posterior tibial artery, which is at the medial side of the, behind the medial malleolus where you feel the pulse. This is an MRA, and you can see the aorta then bifurcates into these. Let's start up and then work our way down. So number 8 is the right profunda femoris artery. And we know that because this is the common femoral artery. This would be the superficial femoral artery, and the one that goes into the thigh would be the profunda. On the other side, this would be the superficial femoral artery, so that's 9. The next thing that we can see is 7. 7 is your tibioperoneal trunk. You can see this common artery before it bifurcates. 6 would be your anterior tibial artery. Yeah, and then 10 would be your posterior tibial artery, which comes off the trunk. It's quite hard to see on this side. I think it's easier on this side. Okay, so we're at the level of the inguinal region. So this would be your external iliac artery on this side, on the right it looks like, but yeah. It's giving off a few branches that we don't need to know the names of. Just don't get confused by it all and don't get, just remember where you are. ASIS, pubic tubercle, the iliac ligament would go, the inguinal ligament would go like this. And so D would be your common femoral artery because we're past that. E is the circumflex artery. C is, this is a circumflex and this is a circumflex artery. I don't think, this is the superficial one. I don't think they'll ask you that. C is the lateral circumflex artery, which is the main one that we talked about that goes around the femoral neck. And then after it's given that, you get the superficial and then the deep femoral arteries after that. So we're at the knee, so this would be the popliteal artery. They're pointing to some branches off these. These are your genicular arteries, which they won't ask you, I don't think, in the exam. Again, genicular arteries, I think these small branches, it would be very unfair to ask, and I don't think they will. So, but this is the tricky bit. So remember, popliteal artery, tibioperoneal trunk, B is your posterior tibial artery, and then A is your anterior tibial artery. This is quite straightforward. So you've got your aorta here. This would be your left common iliac artery, which then divides into the internal iliac and external iliac arteries, which then come down here. D would be your left profunda femoris artery, because you can see it's going into the thigh, it's giving off little small branches, and then this would be your superficial femoral artery. So I think we're getting a bit of a, we're starting to, I think, understand where they might try and trick you. Again, this is where they might trick you, just to emphasize it, because I think I find it quite difficult. You've got your popliteal artery, C is your tibio-perineal trunk, B is your anterior tibial artery. Maybe a good way to remember it is that actually the tibial arteries don't come off the same thing, and then the anterior tibial artery, because it's anterior, maybe it's more important, it's got its own thing that comes off the popliteal artery. And then your tibial perineal trunk, you've got your perineal artery going towards the fibula, and then you've got D, your posterior tibial artery, going behind the medial malleolus. This is something similar. Okay, let's go through this one. A is your left common iliac artery. C is your external iliac artery. B is your internal iliac artery. You can see it's going internally. D is your left common femoral artery. You can see that's like the acis there. The pubic will come like this, so you'll pass that. E is your profunda femoris artery, because you can see the common femoral artery is bifurcating into the superficial and then the deep. Okay, I think we've gone through all of these quite a lot, but we'll do it another time. Left, right, it's given you a label. Let's start with A. So A would be your tibio-perineal trunk, because it's coming off the popliteal artery and giving off two branches. So that would mean that D, we're saying that the anterior one is more important. So the anterior tibial artery is coming directly off the popliteal artery rather than having a common trunk. And then on this side, we can see that this is the common trunk here. And so B is the perineal artery and E is the posterior tibial artery. We know that because this is the left knee, this is the right knee. So this would be going towards this direction, would be the fibular side of things. And so this would be going towards the fibula, or i.e. the perineal/fibular artery, and then posterior tibial here. Let's do this one. This is a CT angiogram, and they've done some post-processing, and so you can see all the arteries. First principles, aorta. A is your external iliac artery. Remember, the iliac arteries, they bifurcate quite proximal to the common iliac arteries, like you can see on this side. So on this side, although we can't see the internal and we can't see the bifurcation, it would have done it around here. So common, and this is what it's trying to ask you which levels these things are. C is the left common femoral artery, because we're past the inguinal ligament, which would have come across like that. And we can see that this would be your superficial, and then this would be your deep going into the thigh. E would be your superficial femoral artery on that side. So this is at the level of the foot, and you know that the posterior tibial artery is behind the medial malleolus, where you feel the artery, the pulse, and so that's what A is. B is the anterior tibial artery, and then in the foot that will become your dorsalis pedis. They've asked you some bones around here. C is your first metatarsal, because this, you can see that this is going to the big toe. D would therefore be your medial cuneiform, which is your medial-most bone at the tarso-metatarsal joint. And then B would be a sesamoid bone. It's hard to tell whether it's the medial or lateral sesamoid, so you just have to say sesamoid bone. Yeah. Okay, that's the end of the talk. I hope that was helpful.